All right, we've started recording within Adobe Connect, and Kevin, you can go ahead and get started.
This conference will now be recorded.
Thanks, Bridget. Good afternoon, everyone, and morning for some of our Western participants. I want to again thank you for tuning in to today's Medicare Rural Hospital Flexibility Program Performance Improvement Measurement System Orientation. Oh my goodness, that's a lot of words. If this does not sound familiar, you might be in the wrong place, but if you want to stick around, we'll be glad to have you. My name is Kevin Cheney. I'm the Flex Coordinator here with the Federal Office of Rural Health Policy, and I will be guiding you on today's webinar. So today I'm going to be talking about, obviously, Flex Performance Improvement Measurement System measures, how they're related to the Flex work plan data, what's changed in our Pims system, and then discussing how program data ties into program impact, accountability, and improvement, how we plan and do kind of, synthesize this data. And as we round third and head home for today's presentation, and that's a little nod for the start of pitchers and catchers reporting to spring training for my baseball fans out there. I'll try to provide maybe a little bit of humor and motivation. As we all know, Pims measures, albeit very important, can also be a bit dry. So, what is the Flex Performance Improvement Measurement System, or as we call it, Pims? It's a data capture tool that we utilize in HRSA's electronic handbook, or as we call it, EHB. And this is where our 45 state designated Flex grantees go in to essentially enter Flex work plan data related to the activities that they were conducting to support cause. And this is done on an annual program basis, and we'll be looking to do the same this coming fall. So, where do Pims measures come from? And when I talk about Pims measures, I want to make sure that it's clear that I'm also talking really about Flex guidance work plan measures, because it's the Flex work plan guidance measures in which Pims is derived, and the Pims measure system. And again, it can become a little bit confusing as you kind of are talking about one thing and you're wondering how does it relate to Pims. And I think the most simple thing that to help us maybe take away from this is Pims is really just a reflection, and the measures in it, of Flex guidance work plan data. And these measures were developed within our office and with the coordination of our partners such as the Flex monitoring team, FMT, and they're really meant to align, our Flex activities when we develop the Flex grant guidance. And the measures that were sent out last week are really just a huge compilation of the Flex work plan guidance measures rolled up together. So, why did we send this out? And what is the thing that I sent out talking about a 30-day Federal Register notice? So I just want to go through real quick kind of a little bit about the approval process that we utilize in order to collect this type of data because it's in a uniform set and something that we're asking for. So again, when our office looks to collect these kind of uniform sets of data, such as work plan data, we need to submit the work plan data containing all possible measures to the Office of Management and Budget, or O&B, for approval. And this is all part of the Paperwork Reduction Act clearance process. And just to let those know who have dealt with our Pims measures in the past, it went through the same process and received approval. And so we're really looking to do this again as that set expired, and we're looking to renew with kind of a revision, including these new Flex work plan data measures and Pims. And so the process includes a 60-day notice, which happened this past summer. It's kind of letting you know, hey, this is coming. We're working on it. And then again, there's a 30-day notice, which just more recently went out and is open for public comment. And if you follow that link, you can go, you can, post a question, comment, as it relates. Hopefully some of today's webinar will help demystify potential comments or questions that you might have. So, as I mentioned, we're going through this process because the Pims measures are changing, and that's because the Flex guidance that came out is new and the measures in there are also different. And I just wanted to iterate that from the last set of work plan Pims measures to where we are now, we did a lot of internal scrubbing. We had a lot of people looking at the data, and really, we were identifying a lot of things. We got a lot of insight from it, especially about just like the process, how many measures there were, timing, the utility of some of the measures in the data that we were seeing. And when we walked away from it, I think the biggest thing, especially for us on the team here, is what can we do to minimize the effort and streamline these as best we could, and really focus on two of the important areas that seem to have the most, I think, meaning that we saw in the old set was CA participation and CA improvement. And by CA, I mean critical access hospital. So for those of you who may be a little bit more visually interested, well, what does this look like? And you might be looking at the Excel spreadsheet I sent out last week and trying to get an idea of where it is that we're going with this. And I hope that this kind of table chart helps maybe explain it a little bit better as a visual, and again, trying to demystify this whole Flex work plan measures that were sent out and how does it relate to Pims. And so I want you to focus on that middle row. And these are kind of the key measures that we're looking at capturing. And again, it gets back to number of hospitals participating in a program area activity, and then the percent with some form of an improvement. And that's why it's underlined and bolded is improvement. I'll talk a little bit more about that later. And then once that data comes in, we analyze it. We look at see how it can inform our program, what improvements we can make, and I'll talk a little bit more about what other things that we are looking to do with this type of data. But I also want to make sure that folks in the states know that we're hoping that this data will also be useful for you and some of the things we're looking to try to change in the PIM system. So, the coming PIMs for this fall, again, I just want to reiterate this because I think it hopefully simplifies what's going to be in PIMs, because PIMs is really nothing more than a reflection of your work plan and what work plan measures we had in the Flex guidance. And so it's the number of CAUs participating in a program area for improvement, the number of CAUs that actually then did improve in those program areas, and what was the dollar amount spent. And these are all things, again, that is reported in your work plan data. I also wanted to make sure, though, that folks understood kind of why we're going this route with the data. And I talked a little bit, and you may remember, those who are familiar with the old PIMs, there was just a lot of measures in there. And so one of the things we immediately did was we went through and we stripped out a lot of those measures. And we focused on the ones that seemed to be the most consistent and brought the most kind of best validity for as far as data entry. And I believe we're right approximately around, we went from about 350 measures to about 175 in this next one. And these measures are meant to also be less granular for our grantees because it's important to also understand that we know that out of all 45 of you and our grantees that you all have varying different levels of need. You have different types of activities that you do, and you all have different levels of improvement that you might be measuring. And again, if we get too granular, we lose meaning with this data. So we're bringing it up to a much higher level, and we think that we'll be able to actually roll this up a little bit better. And hopefully you'll also appreciate just being a fewer set of numbers. And I also want to talk about, this is important because we look to use this data. If you listen to the last webinar, I talked about the triangulation of our Flex data with our MBQuip data reports. What kind of TA request metrics are we getting? We task our Technical Assistance Service Center tracks those, as does our KEDA. We also want to see what can we do to tie in with maybe cost finance reports or other type of financial and operational data. And furthermore, Pims is also, it's a great follow-up to the non-competing continuation that you all will be submitting this spring, because you're submitting a lot of data about where you currently are, but we still have half the year left to go. And so Pims is a good way to kind of close that out. So just some things to keep in mind. The next slide is kind of meant to also, this slide here is meant to show what we, from a kind of federal office perspective, plan to kind of roll this data up. And it's quite simple, percent of hospitals showing improved quality, number of percent of hospitals showing financial improvement, and then operations improvement based on the activities that they're working on. And I want to reiterate that these should be things that we expect our Flex programs to kind of track as just good basic process monitoring and improvement as a part of the program, and keeping track of your work plan, and are you getting there? And it's not meant to be they're not making a lot of improvements, so there might be something wrong, but it allows us to go and investigate why are those gaps there, or maybe they're setting just incredibly high benchmarks, or it can be for a lot of other different reasons. So again, the purpose of Pims is really just a reflection of our work plan data that we're asking for, as noted in the Flex guidance. And when you go through this process, you'll identify which program areas when you're in Pims that you've worked on, and it will open up modules just for those program areas. So even though there's about 175 total questions, I by all means do not anticipate anyone having to answer all 175 questions. So that's really important to note. I think maybe the average could hopefully only fall around a much shorter, number, even far fewer than 75 or 50. So again, that's the goal. Hopefully immediately you'll see that that'll be less of a burden. And, I know that there will be further questions, though, about kind of interpretation and maybe meaning, and we'll be rolling that out and working with you, and just to remind everyone that it's a process. So, this being said, how do we utilize, then, this Pims data? And for us, it's informative because it tells us the impact our dollars are having. It informs us where opportunities exist, where there might be more TA needed or directed. And it's also meant to do the same thing for you as a state. When you are tracking this work plan data and you're entering it, it should hopefully be maybe revealing some insight into how things are going. And it's also important, I just want to remind folks that we also live in a very data-driven world. And here, certainly in the federal government, I'm sure some of our other offices know that they say, show me your data. And we have a lot of those asking us for data, and it's an important group of people. I think I like this slide because it shows, at least from us on a federal perspective, who these people are. One, the American citizen. Congress asks us. The President's, the executive office, I should say, the Office of Management and Budget, as does HHS, and then through HRSA and even our office. And so, this slide for me, it holds a lot of gravity because these are the groups who we are held accountable to, including those DOPS, which represent our critical access hospitals. And, I hear a lot of great anecdotes from the field, and it is great to hear, when good things are happening, good work is happening, and it's certainly something you can translate back to us, in your non-competing continuation, but more importantly, we need to have data. And Pims is one of those pillars that we rely on to go with these tremendous stories and anecdotes, but also because this all boils down at times to a numbers game, and it's, are we moving the needle? Maybe which needle needs to be moved? Is it a different one? And the level of program impact can influence just a lot of other things too, such as program direction, as I mentioned earlier. And it trickles not just through, our office, but through our other programs. And we think about how it relates maybe with other grant programs like the SHIP program and working with our SOARs, but even more so as healthcare shifts, looking at, should we be working with our community-based division a little bit more constructively than maybe we were in the past because of the influence and the focusing that kind of perspective on population health, just as one example. So this is a slide that was in the last webinar, but it's important because I think it helps hopefully show you that we in the federal office work very closely with our partners, such as TASC, Arquita, and especially the Flex monitoring team, to basically help us crunch through the data, and it helps us understand what our impact is, especially in today's shifting healthcare landscape. But it also, we hope, will help remove some of the burdens from you and provide you with more insight about your own data, and then allows you to improve and maybe understand, all right, well, what's happening in my state, and what are lessons that I can learn, or what are lessons that I can certainly share with others. And we're hoping that Pims will certainly help play a part of that. This is not to, as I mentioned on the last slide, we certainly engage with a lot of partners, but I really want to focus on the work that we do with our Flex monitoring team, because they do the Flex evaluation and some really important research work with us. And, we've been working closely with them to do something that's difficult, and that's come to a more kind of standard set of relevant measures as it relates to the Flex program and our critical access hospitals. And it will continue to be a process, and we will need your input and assistance there. And I also wanted to make sure, though, that folks understand, and something we need to do a better job of here, and I want to make sure I do a better job of this, also explaining, like, well, what are the things that FMT looks at, and how do they help us synthesize this information and data, and how that gets rolled back into ultimately making program improvements on our end, and hopefully that's reflected through your programs. So this is another slide from the previous webinar, but it just goes to show that Pims is a part of this, but it's not the end-all to be all. And we do rely on other important aspects and data. And so I didn't want folks to get hung up on, like, this is the only type of information that we're able to capture from your program, but it is important. So how do we plan to kind of use this new iteration of Pims data, and what is kind of this ultimate goal as we work together with our partners? And I think the big thing, certainly for me in our office, is identifying trends, being able to identify best practice and programs in need of additional technical assistance. And that doesn't mean that maybe your state needs additional TA because you're not doing well. There just might be a greater need there, or you might have a different type of need. And I just think that's really important to note. But it also helps us, what states are making progress and are there gaps, and then being able to cross-compare with our quality reports and being able to utilize this data then to help us better understand what are the things that we need to work on, what are the TA resources we need to maybe focus more on rather than others, and help us understand where we stand, and especially our partners. And again, this type of data will also, I think, just provide an additional layer and context for FMT's evaluation work and in-depth analysis and the briefs that they put together. And another important thing, because you're probably hearing, yes, sounds great, it's all federal office. Well, we also want this data to be useful to you, and we're working with our Pims contractor to try and identify, with the limited funds we have, if possible, what charts, graphs, and reports can we put together that then get provided back to you that are easy for interpretation and it's good data. I think that's what we all want. So that's just a little bit of thinking of, how this is starting to congeal on our end. So I've spent a lot of time talking about work plan data and how it relates to Pims and the measures within Pims, as well as kind of the purpose of Pims and then those measures that are there and then what we plan to hopefully do with them. And so those that know me know I'm a huge Star Wars nerd. And I just want to take a small moment, I think, because this can become tedious, but for some fun and motivation, just to hopefully, remind us that this is indeed a process. And at times I feel like it's no different than when Luke Skywalker was traveling to the Dagobah system to receive further training from Yoda, his Jedi Master, and I hope some of you find my Dagobah more like Databah, right? Because we're talking about Pims, at least somewhat humorous. And reminding ourselves that, certainly this process and measurement collection, it can be frustrating, maybe even a bit dull for some people. I know some people get really excited about data, and even confusing. And it's important for us to have patience as we go through this. Our office is going to work hard to make this better, I think more efficient, and hopefully you will also have patience in your office if it's something that you struggle with. And it's okay to reach out to task or to your project officer and say, I just need a little more assistance here. That's okay. It's not meant to be a reflection of something poorly going on in your office. And, ultimately, as we work on this path to improvement, and whether that be through, making sure our work plan data is good and the data we're entering in Pims is great and going over our processes and how can we improve, whether it be at our side or on your side, is it's something that never ends. And try to remember that we at the office and our partners can help kind of be your guide. And there's other Flex coordinators out there who are very excited about data, and I'll give them a quick little shout out, John Ike being one of them. And I know that they're very interested in this area, and they certainly want to see it move ahead and improve. And so I want to just give a kind of a quick kudos as we all try to reach this improvement point. So what's coming ahead? I don't have it here in the slides, but, as I mentioned, and hopefully you're aware, your non-competing continuations will be coming out, be available in a couple of weeks, and we'll have a webinar surrounding that. But moving ahead this summer, more information about what Pims looks like as our software developer kind of gets working on it, and we get a sense of what it's going to look like, and hopefully being able to share more information, both the reverse site visit and webinar as it makes sense. So maybe some screenshots. We'll certainly be providing more information and hopefully some walkthroughs. And, we've been having some great conversations also with F&T about just our data approach in general and where we're thinking. And I want to make sure that you as Flex coordinators have insight to what that process looks like and kind of what's hopefully coming down the road, because we're just looking to make improvements as always with the program, and making sure that you understand the kind of cyclical approach that we have when it comes to data and what types of data that we are using. So, in summary, we talk about a lot of acronyms. I know that was on the last webinar. Someone pointed it out. I wish it didn't have to be that way, but alas, such as the government. So hold tight. If it's something you don't quite understand, feel free to go back and listen or contact your project officer or contact me. I promise it's not as painful as it looks. And I know some people weren't, it was a lengthy process to develop Pims in the past, and hopefully that won't be the case. as much anymore. We've worked really hard to make this a more friendly and less onerous process. And I also, again, there are state offices out there and individuals very interested, engaged in this area, and please continue doing so. I don't want to tell you not to, and keep us engaged. Sometimes we can have our head down because we're just working really hard to try to get to the next thing. So don't be shy to tap us on the shoulder from time to time. And, again, I just really also want to rely or, make sure that folks know, too, like this does get fed back into a lot of the evaluation work as well as a lot of the information then that, our big boss man, Tom Morris, then goes when he has conversations with HHS leadership. And people are interested, well, what is the impact the FLEX program is having? And ultimately, we rely on you as our FLEX coordinators to kind of help pull that all together and let us know. So I know for some of you, you might have said, oh, I wanted an actual screenshot of Pims, but we're not there yet. But in general, I hope I was able to maybe simplify a little bit what we're going to be asking. And really, it's nothing that should come out of left field to you. It's really what is in your work plan and what was part of the work plan measures that we had and listed in the FLEX guidance. So I've rambled on now, and my time is up, but I do want to open it up to any type of questions or comments that folks have, and I think it might be star two to unmute your line, and then after you're done, if you wouldn't mind hitting star two to remute your line. And I'm also just going to say right now ahead of time, I might not have a full answer for some of the questions, but I'll work on getting you one. Well, I guess real quick, I see a couple comments here in the question box, or I should say questions in the comment box. Catherine, I think we're looking for just, for right now, like ballpark figures. We can provide more guidance as we get a little bit closer as far as like with the amounts being spent. I think one of the important things I would touch on about how setting up your work plan. Some of you work with maybe a lot of subs, but ultimately it's making sure then your subs are reporting back the work plan data that you need and holding them accountable too. So I just want to make sure that that's an important, I think, thing I've seen a little bit with some of my discussions. Let's see, what else? Yeah, Kenny, actually, we have some data, and I wasn't able to put it into the slides for this, but I can certainly share some of the data that we collected via Pims that was submitted, and what we utilized for basically letting HHS leaders know, based on your reports, how many COs were like participating in a quality improvement activity, and then based on your feedback, how many actually reported improvement. And we had some really good percentages and a lot of numbers. I think we definitely looked at that data as being important and useful. And now we're at this next stage, and especially with this year's coming Pims measures, of being able to hopefully sync that back with the Telegen reports and things that we get, and working with our other TA providers to maybe think about what kind of summary report could be given back to you as a state office. So when will Pims be due? I think we usually say 60 days after the grant period ends. Maybe from a grants perspective, I'm not sure how we'll be able to fluctuate on that. And we also understand from the office standpoint that there are some things that you may be looking to see, like did they make improvement, but you just don't know yet still by the time Pims is due. And we'll be coming up with kind of guidance about, well, how do you record that? Because it might not necessarily be that they didn't improve, it's just we don't have the data yet, and so we'll be providing some clarification around those numbers. When will the drafted Pims measures be available for the states to look at? I sent that. Okay, so, and I know I was worried this would cause maybe some confusion because it is confusing. The Pims measures that you will see this fall are really nothing more than a reflection of the work plan measures that you saw in the Flex guidance. And in the Excel sheet, you will see questions that I kind of mentioned here under each program area activity. You know, how many CAUs participated in an improvement activity under, you know, like 1.01 or 2.02 or whatever it might be, and then how many CAUs improved under that activity and what was the amount. And then for financial and operation and EMS, there's a couple of other distinct questions because we're still, as part of our office is trying to do, is we're still trying to get a good understanding of what are some of the operational things that we should be focusing on and maybe either promoting or targeting in on, and then as well as having some more EMS-related type data, which, as you know, with Christy Edwards in our office, has been reaching out, and we've been doing more data collection around the EMS area. So hopefully that kind of answered some of the questions I am certainly seeing, I think, on the chat box. And if anyone else has any other questions, I'll do my best to answer them. Well, I was afraid I was going to put you all to sleep. That might have happened. No, just kidding. If you do have questions and you want to talk to your project officer, if you want to reach out to me directly, please do so. You know, I'm looking forward to try to keep this conversation going, and just a reminder that this is a process. And we'll look to make improvements on it, just as we encourage our states and our grantees to make an improvement.